My name is Paul Borraccia, and I'm a social justice activist. And in my area of activism has been for almost 20 years water fluoridation, in educating people about its harmful effects and its ineffectiveness in essence. And like any activist in any field of discipline, whether it be animal rights or human rights or health advocacy, we all start by hearing about something, hearing some information that we feel is wrong, we feel is unjust, we feel that we want to learn more about and tell people about. And that's how I got involved in this particular issue. And I've been involved in the early, from the early 90s to the late 90s, fighting fluoridation in Los Angeles and Santa Monica for a number of years, being an organizer with Citizens for Safe Drinking Water. Now, to give you an overview of water fluoridation, for those of you who may be unfamiliar with it or want to learn more about it, in essence, all fluoridation chemicals are and have always been hazardous industrial waste byproducts of various industries. In the earlier days, it was the aluminum industry, but also glass, brick industries, petroleum refining, and in more recent years, over the last decade or so, the source of fluoridation chemicals has been the phosphate fertilizer industry. And these chemicals are basically what is referred to as scrubber liquor. They are the residue scrubbed from the smokestacks of the phosphate fertilizer industry. And this substance is, in fact, literally classified as hazardous industrial waste until it is sold, and then it magically becomes a sellable commodity. And what drives the fluoridation industry is not that huge money is being made selling these chemicals. It is that they are avoiding the hazardous industrial waste byproduct removal cost by selling this product as a health benefit for public water systems. And that's what's driven it from the very beginning. And that's what drives it to this day. Of course, now it's become a sacred cow, and it's been entwined into the medical dental industry to such a degree that to question it is unheard of in professional circles, at least in the public interface circles, because the actual published peer-reviewed science over the decades has condemned the use of these chemicals in drinking water. Little quote I'd like to read for you. This is a quote from the Senior Vice President of the National Federation of Federal Employees. This was back in 1997. This is the union that represents 1,600 scientists, engineers, and attorneys at the U.S. Environmental Protection Agency. It's a quote from Bill Hersey, PhD. Our members' review of the body of evidence over the last 11 years, including human epidemiology studies, indicate a causal link between fluoride/fluoridation and cancer, genetic damage, neurological impairment, and bone pathology. Of particular concern are recent epidemiology studies linking fluoride exposure to lower IQ in children. So this is in '97. Now, I want to read a second quote to you, which is from the October 1944 issue of the Journal of the American Dental Association. Quote, we do know that the use of drinking water containing as little as 1.2 to 3 parts per million fluoride will cause such developmental disturbances in bones as osteosclerosis, spondylosis, osteoporosis, as well as goiter and we cannot afford to run the risk of producing such serious systemic disturbances in applying what is at present a doubtful procedure. Now, within a couple of years after the fluoridation, the fluoride chemical industry and their lobbyists and PR men had convinced the Journal of the American Dental Association to, in essence, go 180 degrees and become an advocate. Now, this is just another issue like most of us have come to recognize in the current times of lobbyists infiltrating and influencing professionals, representatives, so on and so forth, to hide what is otherwise known to be harmful to the public. Now, aside from the toxicity of these fluoride chemicals, one important point to make is that regarding water fluoridation, fluoride is the only chemical added to public water that has nothing to do with treating the water itself. There are many chemicals added to public water. Chlorine, ammonia, which are chloramines, rust inhibitors, and all kinds of water treatment chemicals. Fluoride is added to the water not to treat the water, but to treat the recipient of the water, to have a pharmacological effect on the recipient of that water. This, in essence, by definition, is mass medication. Now, that may sound sort of alarming or extremist, but it is the simple fact that these chemicals that are added to the water to treat the recipient. And regarding that fact, it wouldn't matter if it was vitamin C that we're talking about. Adding something to public water with the express purpose of treating the recipient of the water without their consent, and often without their knowledge, in an uncontrolled dosage manner, is a gross violation of our human rights, civil rights. It's a violation of the Constitution. It's just wrong. It's a violation of medical ethics. It's a violation of the Hippocratic Oath to treat people without their knowledge or consent with anything. So that's a fundamental point, regardless of whether this was actually good for you, and it is certainly not. A third aspect, aside from how wrong it is and what a violation of our rights and justice that it is, and its toxicity, is that fluoride in drinking water doesn't work as far as preventing dental caries, as far as preventing cavities, and the things that fluoride is added to the water allegedly for cannot be proven in the literature, in the scientific peer-reviewed studies. The actual current information, published peer-reviewed medical studies over the last 10, 20 years have demonstrated, as I read the quote from Bill Hersey, causing lower IQ in children. We also have increased hip fracture rates in the elderly due to fluoride not strengthening bones, but actually making bones brittle and more susceptible to fracture. And there have been one study after another. And you can go to various websites, one of which is fluoridealert.org. This is the website of Dr. Paul Connett, who's a professor of organic chemistry. Also has a wonderful book where you can delve into this research even further, a book called The Case Against Fluoride: How Hazardous Waste Ended Up in Our Drinking Water and the Bad Science and Powerful Politics That Keep It There. Bad science, powerful politics is something we can all relate to regarding things such as the Keystone XL pipeline and the powerful interest behind pushing that. GMOs, genetically modified organisms, and the power of Monsanto. These are just a couple of simple examples of the kinds of manipulation by private corporations that have been going on for as long as there's been private, powerful organizations and corporations. And fluoridation is just one of the earliest deceptions of the public by private industries in order to avoid the high cost of appropriate, safe disposal of hazardous industrial waste chemicals. To read a quote from Dr. Paul Borraccia from his book, and Paul is a professor of chemistry at St. Lawrence University, and a quote from his book: "If we add new evidence of fluoride's damage to the brain and the pineal gland, to its carcinogenicity, and its known toxicity to teeth, bones, and reproductive and other systems, and consider the ineffectiveness of fluoride in drinking water in preventing dental cavities, it is insane for the National Association of Sciences to promote fluoride as a beneficial element. Fluoride is a very toxic substance, and the less our children get, the better." And there's been a growing chorus of scientists, of experts in the field. Now, these experts in the field are the people behind the scenes who do the research. On the public interface level, your doctor prescribing fluoride supplements, your dentist prescribing fluoride treatments are really, with no disrespect to their profession, are cogs in the wheel of a machine. It's what they were taught to believe. It's what they are taught to push. They are not the researchers. They are not studying these issues. They go to school to learn how to do their craft, and they do what they've been taught. And that's the reality of that public interface level of the medical dental industry. Again, with no disrespect to those professionals, it's just the way industry works in developing what you might say is the promotional industry to keep their products moving. Now, I can open things up for questions, and it's always good to get a little interaction going with those in the room.
Thank you, Mr. Borraccia. We have a question. What companies do you know of, or types of companies that benefit from this fluoridation process?
Well, currently, as I mentioned briefly before, the phosphate fertilizer industry. And the way this comes about is the phosphate fertilizer industry mines phosphate ore for the phosphate content. And like any ore, whether it be gold or precious metals, most of what you're pulling out of the ground is other elements, is other chemicals in the ground, dirt, rocks. There's a very small amount of the actual substance you're after. And in a process called acidulation, where the industry uses sulfuric acid to separate the phosphates from the rest of the ore. And in the earliest days of this and other industries, these toxic chemicals were simply released into the atmosphere. These chemicals could etch the glass in windows a mile away, kill cattle in nearby fields. This is a very toxic chemical. But because of regulations, they have installed what's called smokestack scrubbers. So they collect this toxic material which accumulates in the smokestacks. And the material that is actually removed from these smokestacks and used in water fluoridation is a chemical called hydrofluosilicic acid. Now, it's only about 25% fluoride. The rest of it is a wide variety of chemicals: arsenic, lead, mercury. There are polymers and defoaming agents and sulfuric acid, all these chemicals from this very industrial process. And this chemical, untreated, is what is added to public water supplies under the guise of a health benefit. There's an old term that polluters have jokingly alluded to called the solution to pollution is dilution. And like many chemicals that have been dumped into the ocean and dumped into the environment with the idea that, hey, we can just do this forever and there's plenty of room to pollute the earth. The same goes with the climate, climate issues and extreme weather and global warming. These are all interrelated issues. And this mentality of corporate destruction and laissez-faire destruction of the environment and the lives of human beings is becoming all too common and all too much in our faces.
So let's make sure we understand this clearly. They should be disposing of this waste, but the cost of disposing of the waste is so great that instead they figured out a way to manipulate the political system and then get the right to take the byproduct in the waste and put it into the water under the guise of it being beneficial for public consumption.
Correct. And in the earliest days of water fluoridation, most of these chemicals were produced by aluminum manufacturing. And it was Alcoa Aluminum at the time that was the biggest advocate for water fluoridation behind the scenes. And Andrew Mellon of the Mellon family was the president of Alcoa at that time. And this is a family, an industry that owned the Mellon Institute. So they had their own institute and their own staff of junk science, medical individuals and doctors on the payroll to create this myth that this was good for us. The lead propagandist, the hired PR firm, was Edward Bernays. And Edward Bernays is known as the father of modern PR. He was also hired by the tobacco industry in the early part of the 20th century to get women smoking by creating that image of the glamorous, long cigarette holder. Before that, smoking was just thought of as a filthy men's habit. So this is the power of images and PR, and this is the same individual who was at the helm of pushing fluoridation and creating the spin that is still spinning to this day.
Wow. Another question we have is, are there any known cases of the harmful effects of fluoridation? Anything that's been documented?
Oh, yes, absolutely. I mean, the studies I talked about and cited, there's been a number, I think at this time there's about 10 different studies linking. These are published peer-reviewed studies. Many of them come from China. Linking fluoride to lowered IQ in children. There's a number of studies linking increased hip fracture rates in the elderly, I mentioned briefly before. And the known harm to systems, reproductive systems in the body. Fluoride crosses the blood-brain barrier in the body. Dental fluorosis and skeletal fluorosis are the most commonly known. Dental fluorosis is something that is visible to the naked eye. And those people that have children, or especially if you work around children, if you're a teacher and you see small children, dental fluorosis manifests itself as tiny white opaque spots on the teeth. Now, the teeth are the only bones, per se, that we can see with the naked eye. Every time someone opens their mouth, you're looking at their teeth. And dental fluorosis is basically an aberration of the cells that create the enamel caused by fluorides, the poisoning of these cells, and it manifests in tiny white spots. In extreme cases, these spots become black pits. And in countries where this has been studied, as I mentioned, in China, where people have natural fluoride, but high levels of natural fluoride, where their teeth become brittle and break off. And a book published many years ago by Dr. John Yamoyanis called Fluoride, the Aging Factor. This point was based on the fact that people exposed to high levels of fluoride in various countries in the Middle East and in China, men of 30 years old look to be 60 and 70 years old. They're hunched over, that are walking as if their bones are breaking, because in essence they are. And this is extreme cases of fluoride exposure. But something that is a known cellular poison, we see the extreme cases of it. It's well documented. And we also see the harm caused at the common levels that people are exposed to in their daily lives. And a fundamental point about fluoride in our contemporary society is that people are not just being exposed by their fluoride toothpaste or going to the dentist's office. Cryolite pesticides that are fluoride pesticides are contained in many produce, and white grapes, in lettuce, in all kinds of products. Anything produced with water, whether it be beer or soda pop, canned goods containing water. Most of these things are not using reverse osmosis or distillation to process these products. So these products contain high levels of fluoride. Even dry products, cereals that are processed with water that retain the residue, dried fruits, raisins, things like this that retain and then are concentrated when they're dried. So people are being exposed to fluoride every single day when they go to get a cup of coffee at the coffee shop, when they have a bowl of soup or rice or pasta or anything that contains water, been processed with water. So people are getting uncontrolled doses of a known toxic chemical, and the uncontrolled dose aspect is key.
We have a question regarding some, I guess, I don't know if it's hearsay or what, but there's people believing that maybe Alzheimer's or some neurological chronic illnesses may be as a result of fluoride poisoning?
There are links to those conditions. And again, fluoride crosses the blood-brain barrier. This is a very toxic, corrosive chemical. And it also has effects on other organs as well as the brain, the thyroid in particular. Fluoride was even used as a treatment for overactive thyroid decades ago. And the problem with that is that the fluoride molecule mimics the iodine molecule, so that the body does not know the difference between a fluoride molecule and an iodine molecule, which in part was the way they were, from an allopathic perspective, trying to manipulate thyroid conditions using fluoride. But now people are just receiving uncontrolled doses on a regular basis and having these effects. Now, like a lot of issues to do with environmental toxicity and poisoning, the industries will say, well, can you prove that your condition is related to exposure to fluoride in these uncontrolled doses or other chemicals released into the environment? The burden is always put on, the common person, to prove in court up against, billion-dollar corporations. So this is just basically an unfair situation. In other countries, in Europe, There are different ways of approaching these things as opposed to, environmental impact studies that are done here, where the corporations and the manipulation of these kind of studies, just like, again, I mentioned the Keystone XL pipeline, the official president's study that came out said, oh, it wouldn't really cause any problem for the environment and it's very low risk. And well, that's because it was crafted and authored by industries connected to the pipeline itself. In Europe, there's a thing called the precautionary principle. If there's a chance that something might be doing harm to people, if there's an industry producing a chemical that might cause harm to people, you can't produce it. You can't conduct that business or that manufacturing practice. You have to find another way of doing things. As opposed to this country, the burden is on the common person. Many things like phthalates, like chemicals in toys that make toys rubbery and sort of gummy bearish. These are phthalate chemicals. In Europe, they're banned. Can't put those in toys. Can't put those in things that children and babies will put in their mouth. But in this country, there's hardly any discussion about it. And I mention these things because they're all interrelated. This is sort of the corporate incest of infiltrating our environment with toxic chemicals, because that's what chemical producing industries do.
Thank you. Another question has come up, and I'm going to just segue really quickly back to the other countries. So, is fluoride banned in Europe, or are there certain countries that allow it, others that don't? What can you tell us about that?
Fluoride is either banned, discontinued, prohibited in most European countries. Especially, countries like Denmark and Sweden and Norway. Many of these countries experimented with fluoridation. It was touted as, this great thing America was doing. And they observed the deleterious effects in the populations and in people's health. And these practices were stopped in most European countries and banned in some countries. Some countries that have an adverse influence by the United States on their politics and policies still have fluoridation. Again, it has to do with American, when we hear terms like, we're there to protect America's interests. These are just American interests, chemical interests, but it's the interests of the industries, not the well-being of the American people or the people in those countries.
So we have another question. Is there a difference between sodium fluoride and calcium fluoride? Is one safe and one not? What can you tell us about that?
Well, sodium fluoride is a byproduct of aluminum manufacturing. It's what's in toothpaste. And by the way, there is a poison warning on all tubes of fluoride toothpaste. It doesn't jump out at you. They don't want it to jump out at you, but it's in there in the text. On the back of any tube of fluoride toothpaste. So you can go get your tube of fluoride toothpaste and you'll find it. And it's been dumbed down over the years. It used to be a lot more shocking. Paraphrasing, they would say that if you swallow a pea-sized drop, more than a pea-sized drop, or more that is used for brushing, that you should contact a medical professional or call the Poison Control Center immediately. Now they say call the Poison Control Center right away. They change. Language is powerful, and immediately raises eyebrows. Right away is like, well, have lunch and order a pizza first. But calcium fluoride that occurs in nature, fluoride is fluoride. Fluoride is taken from nature for various manufacturing processes. Fluoride, uranium hexafluoride was even used in the development of the atom bomb and the Manhattan Project. It was one of a myriad of toxic chemicals that were used, and there's been many stories over the years that have come out about the harmful effects to the people that actually worked on the bomb of all the chemicals that were used. Well, sodium hexafluoride was one of those chemicals. These chemicals are all derived from nature originally. You know, if you pull arsenic or mercury out of nature, you know, it's toxic in nature and it's toxic out of nature.
Exactly. Okay, so last question, and we'll wrap it up. What can we do? What can the average person do? You know, what do you think we should be doing about this at this point?
Well, I think I can say this, that like a lot of activists in the myriad of issues in the past and currently know that just protesting in the streets and organizing is not enough. It's part of it. Education. Education is how every activist in any topic you could name got into what they're doing, because they heard about something and it pissed them off and they thought it was wrong and they just couldn't not be involved. And people, excuse me, people with children in particular are concerned about their children and their children's children. And, you know, we all have a stake in humanity. But education is huge. And the current campaign is a feature-length video produced by Dr. David Kennedy, who is the founder of Citizens for Safe Drinking Water. And you can find this free DVD at fluoridegate.org. That's fluoridegate.org. And it's called Fluoride Gate, An American Tragedy. And again, Dr. Paul Connaught's website, which is fluoridealert.org. There's also keepersofthewell.org. There's tremendous information if you are interested in finding it.
Great, thank you. And are there any, is there any technology that we can use to get fluoride out of our drinking water?
Yeah, there is. Most technologies are ineffective. As a result of being involved in fighting this and looking for my own sources of safe drinking water, I ended up in the industry myself, in the water purification industry, as a result of trying to find my own answers. It was just sort of osmosis, no pun intended. But distillation is one means of removing fluoride. Reverse osmosis combined with deionization. Reverse osmosis will remove most of it, but not all of it. But if you combine it with deionization, it will remove it to undetectable levels. And the reason it's important to not to avoid any fluoride exposure to the best of our ability, which is very difficult in this environment, as I just had described, is that, and this is something that was pointed out by Dr. Hardy Lineback, and he's a professor of dentistry at the University of Toronto. And just a little bit on him, he is one of the scientists and dental professionals who used to be one of the biggest advocates for water fluoridation in Canada. And he did something that's rare for a professor of dentistry and someone who's at the forefront of promoting fluoride and actually has a dental practice of his own. He did something very rare. He started doing his own research, aside from what he'd been taught at the university, aside from what had been touted by his professors. And he started doing his own research, and he was horrified and shocked. And as he says, it took a couple of years for it to sink in. And he realized that the industry is incorrect in its promotion of water fluoridation. I think I have a quote here from Dr. Hardy Lineback. Let's see. Yeah. He says, here, quote, here in Toronto, we've been fluoridating for 36 years, yet Vancouver, which has never been fluoridated, has a cavity rate lower than that of Toronto's. In Canada, we are now spending more money treating dental fluorosis than we do treating cavities. That includes my own practice. Your well-intentioned dentist is simply following 50 years of misinformation from public health and dental associations. Me too. Unfortunately, we were wrong. Poisoning children was the furthest thing from my mind. End quote. So one of the main things he pointed out about fluoride is about half of the fluoride you consume in your lifetime will never leave your body. It doesn't just go through your body like vitamin C. It will be retained in your bones, in your brain, and because it crosses the blood-brain barrier, this is where we get back to your earlier question about Alzheimer's and brain conditions. So it's a very pervasive toxin, and it has no place in our drinking water or prescribed in supplements to children or in bottled water or in anything touted as a benefit.
Well, thank you very much, Mr. Borraccia. And if you'd like to make any parting words or statements, please do.
Well, one point I'd like to make, I relate this back to Aaron Brockovich, and most people have heard of Aaron Brockovich, who fought the big chemical company, PG&E, that was polluting the water supply of Hinckley, California, indirectly. And the way they did that, which is very much related to water fluoridation again, this plant that poisoned the water with chromium-6, they don't want to pay to dispose of these chemicals either. This is how these chemicals get in the water, whether it's chromium-6 or fluoride, and a myriad of others. But what they were doing, and many chemical companies do this, same thing with the coal ash. Recently we've heard about the coal ash spill in Virginia. And a few weeks before that, chemicals that leaked into the river and into the water supplies of 300,000 Virginians. Is industries that have a large property tend to dump these chemicals onto their property, whether they create an earth dam or they just dig big pits, and they literally create lagoons of toxic waste on their properties. And because, again, it's all about not wanting to, it's all about the bottom line, right? And part of that bottom line is also not spending the money on safety procedures, on protecting workers, on protecting the public, on protecting the environment. The less money you spend, the more it goes into the pockets of the CEOs and the shareholders. Again, this is the bottom line issue of every, corporate, industry, particularly the ones producing chemicals and pesticides and pharmaceuticals, and and they're all related. Most of them are all doing everything. It's a corporate incest, and I use that word because it is ugly. It's very ugly when money is more important than human beings. But in Hinckley, California, this is what this industry was doing. This corporation was doing, simply dumping chromium-6 laced chemicals onto their property because they had a large property for years and years and years. Well, eventually, just like fracking chemicals that are pumped into the ground intentionally, these chemicals just dumped into a big hole eventually find their way into the water table and into the closest water supply, whether they're blasted into the earth, for fracking purposes, to try and squeeze the last bits of oil and gas out of the earth, or whether they're simply laid on the surface. They all, gravity is a bitch. And the water supply is where these chemicals always end up. And you can look at MTBE and other chemical that leaked into the water supplies in Santa Monica and other areas. We could go on and on and on. It's all very related. Fluoridation was just one of the first biggest scams. And when I had an opportunity to have a conversation with Erin Brockovich a number of years ago, and I really brought this issue to her attention, and I went to a book signing and waited to be the very last person so I could have a dialogue. And what I said to her, and I'll end on this note, I said, Erin, in Hinckley, California, you were there. You were there to stand between the propaganda and the public. Because in Hinckley, California, they're already starting to spread propaganda. Oh, you know, it's like chromium perchlorate. It's healthy, it's good for you. Don't worry about it. You know, they're all already starting this. And I said, what if you weren't there? What if you weren't there, Erin Brockovich, in Hinckley, California? What if they got away with it? Well, that's what happened with fluoridation. They got away with it.